mom's life. After waiting for 9 months and going back and forth to the obstetrician and listening to the heartbeat, all of a sudden the baby's born. But that can be extremely difficult after you take the baby home, and when some women will oftentimes battle something called postpartum depression. The birth of a baby can be just a whole trigger of powerful emotions, from excitement, joy, to fear, anxiety, resulting in something moms might not even expect, called baby blues and postpartum depression. What are baby blues? Well, baby blues are a syndrome and experiences of mood swings, crying spells, anxiety, and difficulty sleeping. When new moms come home, they can experience something called baby blues immediately after childbirth and or within 2 to 3 days after the baby is born. Makes it difficult for them to sleep. There's all of a sudden, out of nowhere, you're excited about having had a baby, and now you're crying all the time. Sometimes you're challenged because breastfeeding may or may not go the way that you would like for it to go, and it could be disappointing. What tends to happen within the first 2 days after delivery, once the mom's home, you start to experience something that really, really makes you uncomfortable, crying and worrying. One of the things you have to know is that this is normal. Baby blues is short-lived, and it's experienced probably about 80% of women who have babies. In most of these situations, when women experience baby blues, spousal support, family support, social support allows the new moms to recover from this baby blue state. That's why in our culture, most of the time when a woman has a baby, the mom is there to support her because women are just exhausted after they've had hours and hours of labor, sometimes surgery to deliver the baby, just pushing and pain. And so rest is very important, and women can't seem to find a way to rest and or struggle with making sure that they have the emotional stability to care for the newborns and to be excited around the newborn. Generally, moms are there to help out. So in addition to external support with managing postpartum blues, good rest and nutrition is necessary to make sure that you are handling this as, I'd stop here. In most cases, if baby blues are noticed, if you're having trouble with sleeping, if breastfeeding gets difficult, if you're real emotional, or feel like you're inadequate as a mom to take care of this brand new baby that you've been blessed with, first I recommend that you talk to your doctor about this. Make sure you let your provider know, because your provider is the one that will give you the understanding of what to do and to make sure that the diagnosis is correct. So in addition, when you have postpartum blues, there's a need to have external support. Support from your spouse, support from perhaps a family member, support from other caregivers that you will allow to help you after you've had the baby. Adequate rest is so important. It's important too to eat good food, good nutrition, and to make sure you're drinking lots of fluids so that the milk let down is adequate and it's not causing a lot of stress, because there can be some challenges in that regard. Let your provider know if lactation support is necessary, if there's an infection around your breast, or if there's an infection at the nipples at the time. Engaging your provider is very, very necessary during this time. And one of the things we can assure you about the postpartum blues, it gets better and you can get out of this, but it does require support and it does require patience. And thirdly, it does require knowing that you're normal, there's nothing wrong with you, and then that you haven't done anything wrong. Now sometimes the postpartum blues get even more severe. Some moms will experience a longer lasting form of depression where they're crying and they're just not able to get back on track, feeling like, man, I'm not doing well. I'm having the wrong thoughts about being a mom. I'm having the wrong thoughts about how to care for my baby. And so that goes into a term called postpartum depression. Now, postpartum depression usually is the way you can know the signs and symptoms of recognizing postpartum depression. If there's profound sadness, loss of hope, despair, sometimes women will cry a lot for no reason at all, just all of a sudden just crying, or there's a lack of interest in food, lack of interest in self-care, not wanting to touch the baby, not feeling like you're qualified to care for the baby, just feeling like the baby is not going to make it, feeling like you're not going to make it, feeling unable to do basic chores. And so when you start to get disturbing thoughts that may even cause you to want to harm the baby or harm yourself, you have to talk to your provider and make sure that the people around you will understand that you need to see someone to get some professional help. Most important thing about this is getting some help. Postpartum depression really is more common than you actually think. 1 out of every 7 women that have babies will experience postpartum depression after childbirth. So that's about 15% of women. So if you count 7 women, the first one out of every group of 7 women will have had this. What are the causes? Why do we get it? Well, research tells us that postpartum blues and postpartum depression is triggered by changes in the hormone system that women will experience after having the baby. These changes are ongoing, and these changes occur after the baby is born. There's a certain amount of hormonal contribution to get the baby out. Then there's hormonal support that you need to make sure that you maintain milk production after delivery. What's also important for you to know about postpartum depression is it's not a weakness or character flaw. Sometimes it's just a complication of giving birth, a consequence of giving birth, if you will. And it's also important to know if you have postpartum depression, prompt treatment and getting help is going to be the best way to get through this. Another thing you need to know about postpartum depression, we talked about hormones. That hormonal support is what lends to the changes in your emotion. There's also something called oxytocin. Oxytocin is the milk letdown hormone. And we believe as doctors that plays an important role in postpartum depression, especially in women that have lower levels of postpartum oxytocin hormone. These women will lack mild production, and sometimes these women will actually have difficulty with breastfeeding because the milk let down from hormone production of oxytocin may be lower than what it should be. So this lack of mild production of oxytocin can cause some women to switch their moods from being happy, euphoric about having a baby, switch their moods to being depressed and discouraged that they're not able to do a good job with taking care of their baby. Another thing that's important to know that may not always be discussed is that men can experience postpartum blues. That's right, men can experience postpartum blues. Medical research shows us that probably sometimes among new dads, 40% of them will experience postpartum blues. And that happens simply because they're under stress, they have anxiety, and they have feelings of not knowing what to do, not knowing how to help you as a new mom, and also not getting the attention that they once got when you were able to give them attention. Now the attention is shifting to the newborn. So pay attention to dads that may feel guilty, that may feel stressed, that may feel inadequate in order to support you. So you have to remember that 3 things that are important is that men can experience it, it's very prevalent, 1 in 7 women can experience it, and also hormones, we say, are directly impacting of postpartum depression. We talk about postpartum depression and you've identified the signs. Here are the things that you should do. Always remember, you should pay attention to the signs. If someone is telling you, really concerned about you crying a lot, if they're concerned about you not wanting to touch the baby, if they're concerned about you not feeling like you're able to care for the baby, or concerns that you just need some time or feeling stressed or unable to handle just basic household things like washing dishes or, making up the bed. Those things sometimes can let you know that there are signs that things are going wrong and are not quite right. The first thing you need to do is you need to talk to your doctor, because it's the doctor that will have to give you the diagnosis of postpartum blues and postpartum depression. If you think you have that, the doctor, after talking to him right away, sometimes he'll recommend good support, surrounding yourself by family members that can help you. Bring in your mom, bring in your aunt, bring in a part of your village that's going to help you get through this. He also will talk to the spouse sometimes just to make sure that he's doing okay, that he's not too tired, not too exhausted, or feeling like he's not getting the attention he needs through this as well. Another thing that the provider will also suggest is to make sure you're carving out time for relaxation and rest. Rest is so important during this time, because if you're not able to get adequate sleep, emotionally you'll be hypersensitive, and small things will become way out of proportion than the realized situation. So rest is very, very important. You also want to make sure that as you seek remedies and tips for working through postpartum blues, is that you're setting simple goals. Okay, this morning, just decide I'm going to just make up the bed today. Or this morning, I'm going to just make sure all of the nipples and all of the bottles are clean. This morning, I'm going to just make some time to just do a devotional, just to give myself some spiritual support. So set a small goal. And in setting a small goal, the more small goals you reach, the better you're able to feel like you're really getting on top of this. Another thing that's important as you pay attention to the signs and set small goals is to exercise. If you're feeling up to it and there are no other comorbidities or no other existing medical concerns like hypertension or infections, then you want to make sure you can get your tennis shoes on and walk. Even if you're just walking back and forth to the mailbox or walking up and down the driveway, get some exercise every day. That's going to be very important. Nothing strenuous, but the small amount of exercise you get will increase your endorphin release. And once your endorphin releases improve, then you'll start to feel better. And it'll give off symptoms of, I'm going to do okay, I'm going to make it. Good nutrition is so important. You got to eat right. Got to drink plenty of water. If we want milk to come down, if we want to be successful with breastfeeding, drinking water is your best friend. Healthy fruits and vegetables just to give you the fuel and the energy that you're going to need to be able to care for another person. As you notice now, when you're having this new baby, it's just as much about the baby as it is about you. So it's almost like the saying goes, put your own mask on first, so then you can be support to your little one. Good nutrition is very, very important. Sometimes, as we said, patients with postpartum blues can go on to have depression. And when we notice that, we of course have talked to our provider, our physicians. If symptoms continue to worsen, sometimes some ladies will have thoughts of harming their baby, thoughts of harming themselves. We've got to get those people to their provider to be evaluated further. When the doctor sees you, he or she will decide if medication is necessary. In some cases with postpartum depression, antidepressant medication may be necessary if the hormones are extremely off balance, extremely off kilter. We do notice sometimes with ladies that have a borderline or just some pre-existing proclivity towards depression may go over into that lane of major depression with postpartum and have some severe signs that may require some medical therapy. Whether or not medical therapy is required talk therapy is going to be necessary. To seek help from a clinical psychologist that's capable of dealing with this, capable of teaching you how to recognize when you're having negative thoughts, and teaching you how to process them and knowing what to do about them. That's key. That's very, very important in getting through postpartum depression. So when we talk about medications that are involved, only your doctor can prescribe medication. So don't allow anybody to give you any kind of medication that's theirs. You have to make sure you're talking to your doctor about what may be necessary for you. When you have medications on board for postpartum depression, let your doctor know that you're breastfeeding, because that will require a prescription for a certain kind of medication rather than others if you're wanting to continue to be successful in breastfeeding. Overall, the counseling approach obviously is so necessary. And if you also discuss with them about things that are happening, it's good if your spouse can be there with you. He may also need some support, and I think that could be a great way for both of you guys to progress together. This is so important to know, because with everything that's going on in our world today, everything that's happening in society, the virus, the pandemic, finances, the country, everything that we're dealing with, you gotta get on top of this postpartum blues and postpartum depression, because if not, you'll see how it can really make for a difficult time with enjoying this brand new baby that God has blessed you with. So overall, there are tips that I want to leave you with, and the main one that I want to leave you with is that you're not abnormal and you're not alone. There's nothing that you've done. You're not of any danger to yourself or to your baby, particularly if we catch it early. And then other women have experienced this, and then other women also have come out of it. So make sure you know that if you are experiencing postpartum depression, that you can get through this. Keep an open mind, follow the tips of nutrition, exercise, good support, talk therapy, and you can get through this. Postpartum depression, postpartum blues is conquerable with the right things in place. Thank you.